Hey everyone, welcome back for another deep dive.
Yeah, always fun to dig into these cases.
Today we're taking a look at a
Really?
fascinating case study straight from the New England Journal of Medicine.
Oh, nice.
And this one is a real medical mystery, so
Buckle up. Well,
get ready. Yeah.
yeah.
Imagine you're dealing with like the worst stomach pain you can think of.
Uh,
But all the tests, everything comes back normal.
yeah, that's always a head scratcher.
That's exactly what happened to this woman, and I don't think you're going to guess what the diagnosis ends up being.
No, I'm intrigued. Let's hear it.
Okay, so we've got this 53-year-old woman, and she's showing up at the ER like twice a week
Wow.
with this super severe abdominal pain.
That's frequent.
I know, right? So they do all the initial exams, they even do a colonoscopy, but they can't find anything wrong.
Huh.
Nothing. No history of anything similar, no family history, nothing.
So like a completely blank slate.
Pretty much. What would you even start thinking about with a case like that?
Well, I mean, that's when you really got to put your thinking cap on, right? You have to start considering those rare conditions, the ones that don't immediately spring to mind.
Like, what are you even looking for at that point?
Well, it's like trying to solve a puzzle with, like, half the pieces missing. You got to think outside the box, look for patterns, and sometimes just follow your gut.
Okay, so in this case, they decide to do a CT scan,
Ah, good call.
and that's when they finally catch a break. The scan shows that her intestinal walls are thickened, and there's all this swelling in the tissues around her intestines.
Mm.
They call it mesenteric edema.
Right.
So obviously that rules out simple things like appendicitis.
Yeah, definitely. When you see those kinds of findings on a CT, it really starts to narrow down the possibilities.
So what kind of things would you be thinking about at that point?
Well, thickening of the intestinal walls and mesenteric edema often point to some kind of inflammatory process going on, or it could be a condition that's causing fluid to build up in that area.
So inflammation, fluid buildup, but still what's causing it?
Right, that's the million-dollar question.
Well, lucky for us, they did some blood work. And the results showed low levels of certain proteins. C4, C1 inhibitor antigen, and C1q.
Interesting. And did they check her C1 esterase function?
They did, and it was decreased too.
Okay, now we're getting somewhere.
So for those of us who didn't go to med school, can you break this down? What do these blood test results actually tell us?
Sure. So these proteins, C4, C1 inhibitor antigen, C1q, they're all part of what we call the complement system.
The complement system.
Yeah, it's basically like a first line of defense for your immune system. It's this complex network of proteins that work together to identify and neutralize threats, like bacteria and viruses.
So like an immune system SWAT team.
Exactly. But here's the thing. This system needs to be carefully controlled. If certain proteins are missing or not working properly, it can lead to a whole bunch of problems. And one of those problems is angioedema.
Angioedema. Okay, now we're getting to the good stuff. But before we jump to conclusions, they wanted to rule out hereditary angioedema, which is the most common type, right?
Right.
So they ran a genetic test looking for mutations in the SERPING1 gene. What happened there?
The genetic test came back negative. And that's a really important piece of the puzzle because it tells us that we're not dealing with the inherited form of the condition.
So if it's not hereditary, then what?
It points towards an acquired form of angioedema, which is a bit trickier. It can be caused by a number of things, and often it's associated with other underlying health conditions.
Okay, so at this point, we've got a patient with severe abdominal pain, a CT scan showing intestinal issues, blood tests pointing to a complement system problem, and we've ruled out the most common type of angioedema. What happens next?
Well, they took all of that information, her age, the lack of family history, the blood test results, and those CT findings and put it all together. And they came up with a diagnosis. Angioedema of the intestines due to acquired C1 inhibitor deficiency.
Wow, that's very specific.
It is. And it's not always easy to pin down. Acquired C1 inhibitor deficiency can be a real chameleon.
What do you mean?
Well, it can be triggered by a bunch of different things, like lymphoproliferative disorders or autoimmune diseases. But in this case, even after doing more tests, they couldn't find any obvious cause for her C1 inhibitor deficiency.
So they know what's wrong with her, but they don't know why.
Exactly. And that's actually not that uncommon with acquired angioedema. Sometimes the trigger remains a mystery.
Okay, so mystery trigger or not, at least they finally have a diagnosis. That means they can start treatment, right?
Right. And in this case, they decided to treat her with danazol, which is a medication that can help manage angioedema.
And did it work?
It did. Within 2 months of starting treatment, her abdominal pain had completely disappeared.
Wow, that's amazing. So case closed.
Well, not quite. The fact that they couldn't find a specific trigger is something to keep in mind. It means she'll probably need to be monitored long term to make sure the angioedema doesn't come back and to watch for any other potential complications.
I see. So even though they solved the immediate problem, there's still a lot to learn about her case.
Absolutely. And this case really highlights something important. Even when all the initial tests come back normal, you can't give up. You have to keep digging, keep asking questions, and be willing to consider those less common diagnoses.
It's like a reminder to never underestimate the complexity of the human body.
Yeah,
Yeah.
totally. And it also shows how much we still don't know about acquired angioedema. Like, why do some people develop it without any clear trigger? And how can we get better at identifying who's at risk? These are questions that researchers are still trying to figure out.
So even though this case has a happy ending, it's clear that there's always more to learn.
Definitely.
And for our listeners out there, I think the takeaway here is that you should never be afraid to advocate for yourselves. If you're dealing with persistent symptoms that just don't make sense, keep pushing for answers. Don't be afraid to ask questions, seek second opinions, and do your own research. You never know what you might uncover.
I totally agree. Sometimes the answer to a medical mystery is right there in front of you. You just have to know where to look.
Well, that's all the time we have for today's deep dive. Thanks for joining us, and we'll see you next time.
See ya!
Bye.